My job today is to kind of just give you a little bit of information about cosmetics and what's out there right now. There are a lot of myths and rumors and just different things that people come to me and say, what about this, or is this right? And there's no one approach. This is what people come to me and say, I want to reduce my wrinkles. That's what men and women want the most, reduced wrinkles. So if you look here, 52% of the population is between 25 and 64 years of age. That was back in '01. In '09, that number's climbed to 58.5%. So over half of our population is in this age range of where we're aging. And in the next few years, you're going to see a lot of the baby boomers get older and older, and they're going to want to look as good as they feel because, as you'll hear from my wife, you want to basically live your life until the end. I mean, you don't want to sit in a nursing home or a wheelchair. You want to be out there and enjoy the golf on a nice day like today. So you want to enjoy life, and you want to look good too at the same time. So facial aging is what I'm going to talk about. As you know, over the years, gravity takes its toll, starts up, pulls gravity down, and all sags and goes down. So what happens is your dermis will thin, you lose elasticity, everything gets, the elasticity of your skin essentially falls apart. You start seeing bony landmarks, blood vessels, wrinkles. You start getting the transverse forehead lines up here. The eyebrows start falling down. The corners of the mouth come down. I have a lot of women say, can you make me smile again? And the nasal tip starts dropping a little bit also. So these are some common myths that aging is normal. Well, I mean, everybody ages, but it's how you handle it is how you're going to do it. Botox is very dangerous, so I will look frozen. Fillers make me look fat, and I don't want big lips. Those are the big myths out there. So this is a very interesting study back in '09 in Allure magazine. They took a series of twins, 168 twins, and they looked at how they aged. And these are some of the findings that they took because twins have the same genetics, but the environment is what plays a part. So what they found, and you'll hear this from my wife's talk, is the longer you take, in this study was birth control pills or hormone replacement therapy, you look younger. Okay, now you'll hear from my wife, birth control pills can be dangerous in some situations, but for the most part, you want to maximize your hormones. Taking antidepressants, you look older. Okay, so that's actually can be like a toxic effect on you. Women who didn't drink look younger than the twins who did. So, as we all know, alcohol is a toxin per se, but if you drink in moderation, it's probably fairly okay. But for the most part, you don't want to overdo it. This was interesting. The longer that you smoke, the older you look. And we kind of know that. You can tell a smoker just by looking at them sometimes. But the funniest thing is this one here. The divorced women look 1.7 years older, but the widows look younger. So instead of divorcing the men, maybe have an accident or something. So who knows? And the last thing Kelly will talk about is the UV exposure deepens your wrinkles and models your skin. One of my articles I read lately about dermatology is they're seeing an incidence in malignant melanoma in 30-year-old women. And what they're finding out is all the tanning beds and tanning that they do in the 18, 19, 20-year-olds, they're getting cancer in the 30s. And it's increasing over the years now. So it's just something to think about. This is interesting about weight, okay? If you're over 40 and you have a little extra weight, you look younger. And that's not necessarily a bad thing. Under 40, the effect is opposite. If you actually have extra pounds when you're under 40, you can actually look a little older. And I'll see this in some of my ladies who are in their 40s that are very healthy, very fit. Some of them are personal trainers. They have such a lean body mass, they actually lose the fat in their face. They look a little older. That's where the fillers come into play a little bit later. So I'm going to talk a little bit about Botox, and I'm sure if anybody here who's had Botox before knows about the 11s or the 1s, the 111s. These are the glabella lines. I have one lady come and tell me I have 1,011, so it's too many wrinkles. So essentially, what are they and where do they come from? They are the vertical lines between your brows, so whenever you frown, furrow, you'll see them come together and form wrinkles. Now, what happens is that years of squinting, yelling at your kids, concentrating, reading, makes it get worse and worse and worse. I liken it to taking a piece of cardboard, folding it multiple times. Over time, you'll see a crease form. So what Botox is trying to do is prevent that from happening. So what you're trying to do is relax that muscle so you don't keep wrinkling. So what Botox is, it's very safe, it's very unique. It's been out there for many years, as you'll see in the next few slides. It actually was introduced as a cosmetic version in 2002. Medically, it's been used since the early 70s for different procedures such as neurologic problems, migraine headaches, muscle spasms, cerebral palsy. But in the late 90s, they were finding out that if you injected migraine headache sufferers with Botox, the wrinkles would go away. And that's how they find a lot of these secondary uses for drugs these days. So since then, they've done almost 11 million procedures. So it's very safe, very efficacious. Okay. So how does this work? You'll get those frown lines caused by repeated muscle contraction. So what Botox does, you actually inject it into the muscle to paralyze that nerve. And when that happens, they just quit working. Now, people say, oh, is that safe to have this in my body? It is very safe because it doesn't go anywhere else in the body. It's only in that muscle. There's been some studies in the past of people using research-grade Botox kind of on the side. That was in Florida about 10 years ago. They actually became paralyzed all over and had to go in the hospital, but that's research grade. This is the very safe Botox version. All right, so 10 minutes takes about less time to do this and even to get a haircut these days. In my case, even quicker. So, so you'll see this in about, you'll see results in about 2 to 5 days, and in about a week, what you'll see, they just quit moving. Whenever patients get this, 92% of patients are very happy with it. So who is the main user? If you see in this picture, it's not the kids, but the mom. So usually what we're seeing now is a lot of middle-aged, 30, 40, 50-year-old women coming. I got some women in their 20s now starting also because they see their mother's wrinkles. And they don't want to have the wrinkles like their mom does. So they'll come in and they'll start doing a prophylaxis Botox for the wrinkles. So you'll see before day 2, day 14, and 3 months, it's about how long it lasts. And here's another version of it here. So you'll just see at day 14, and there's some before and after pictures. And when I do this on most patients, I'll do the procedure, and they're kind of tense, and I'll say, you know, it's not going to hurt. Oh, I'm kind of paranoid of the needles. In about 2 minutes, I'm done. They're like, that's it? So it's very, very easy to do. It's non-surgical, lasts about 3 months, very easy to do. And so if you wrinkle so much, you get what's called a U-shape. Your forehead muscles actually start working also. So we paralyze it. So she still has her 11s, but she doesn't have this gaping of all the skin. Yeah, it looks very angry. Men, we're starting to see a lot more men do this. I've got a few men who work in Houston who actually go on TV that we do them. Crow's feet's a good one. She still can wrinkle, but it's not bunching up. So just a simple procedure. You think, oh, I need a facelift or an eyelid lift for that. Nope, just a little Botox. And here's me. I always put my picture. Shar-Pei puppy. When I started shaving my head years ago, that's back in '05, that's how I looked. So then I started using it now, and pretty smooth. My brother, he lives in Miami, Florida, so he's 4 years younger than me. Doesn't do Botox. He's in the sun all day long. He's got these lines all up and down his forehead now. So that's genetics playing effect versus environment. All right, dermal fillers. Everybody, wants to look good these days. They want to look nice, but they don't want to look like Angelina Jolie's lips. They come in, I want lips, but I don't want to look like her. And that's okay because hers are nice lips for her, but for me, my patients again don't want to look fake. When I do lips and you walk out of here, you basically have a little bit of increased volume, but not enough to cause anybody to take a second glance at you. So for fillers, we want something that's long-lasting but not permanent, because if you do something permanent and there's a problem, you got to be careful with that. So that's why I tell everybody when you go do something, make sure what is going to happen once you do it. So the good thing about Botox is it's gone in 3 months if you don't like it. The good thing about these fillers is they will go away over time. Some of the fillers out there, silicone, that's been used before in the past, that is permanent. So you got to be very careful when you do things like that. You want something with minimal side effects. Allergy testing, you do collagen injections, you have to allergy test people. You want something that's cost effective, that works very good and natural looking. They also want immediate results. Fillers are immediate. Botox takes about a week. You'll see immediate results with the fillers. Minimal discomfort, they don't want anything to hurt. Modest downtime, 10 to 15 minute treatments, and usually 1 or 2 treatments. So what's out there right now, there's Juvederm is one of the largest selling fillers right now. Restylane was the original hyaluronic acid. This is the 2nd generation. So what happens is they made it cross-linked so it lasts longer. It's very good for lips and nasolabial folds. So this is one picture for the men getting a nasolabial fold there. And then this is a lady who had uneven lips on that side, and so we filled up her lips to make them a little bit more even. So this is directly after, so they are swollen, but she's not going to walk out. It'll settle over a couple days. And then the second filler that's out there is called Radiesse. This is a dermal filler which lasts up to 2 years, so a little bit longer. It's what we call semi-permanent. It will dissolve, but it's calcium-based, so it's very natural. It's the same as what your bones are made out of. Gives a very smooth appearance whenever you put it in. You actually can restore volume to cheeks, under the eyes. You can actually go around the mouth. So for people who've had facelifts, a facelift just works on the skin. It doesn't work on the volume below the skin. So even if you've had a facelift, you still need some volume sometimes. So here's a picture of Radiesse, same thing, nasolabial folds. This was a gentleman we did. If you look at him, he's got severe folding of the nasolabial folds under the eyes, so we put syringes on his cheeks. Kind of plump those up a little bit. This is another one, nasolabial folds. And this is one of our better ones. Allison's my assistant. She does it as well as I do. This is one of our guys. So if you can see, he's years of sun. I can't remember if he smoked or not, but lots of wrinkles. So if you look, we put Radiesse on his, just in his cheeks alone, took away half the wrinkles in his face. Made him look younger immediately. So that's what it does. Whenever you fill things up, those wrinkles stretch out.